I don't think that when you Google Boston, you get the true story of what the city looks like.
I was more than surprised at how diverse, but also how fun Boston can be. Working here, especially as a healthcare professional, I don't think it gets much better.
When I came to Boston, I never thought that I was going to have the opportunity to work with a large Latinx population. But you don't realize how big of a Hispanic community or Latinx community we have. It's almost 18 to 20% of the city that identifies as Latinx.
I'm part of the primary care track, and so I spend my time both at Healthcare Associates and Bowdoin Street, which is a clinic in Dorchester. It's a community healthcare center. The population there is mostly Cape Verdean, which is a small island off the coast of West Africa.
My primary passion, clinically and professionally, is working with underserved communities and communities that have been historically marginalized by the healthcare system. And a lot of that has been through my experience in ID with HIV, tuberculosis, and hepatitis C. I do a continuity clinic here at BI through my fellowship program, but because of my passion, I also work at Cambridge Health Alliance, which is like an academic affiliated community hospital and has a mission to work with and provide equitable care to vulnerable populations, specifically immigrant populations. Through those experiences, I've gotten to work with very special patients and learn from really dedicated, passionate providers. Also really get to learn more science and learn more about how to manage these very specific conditions.
I think BI has really aimed and attempted to achieve a ton in terms of improving the equity of care in Boston, especially our patient population. At Bowdoin, certainly learning how to provide patient-centered care and a lot of the sort of ancillary support that we have, whether it's nutrition, fair foods efforts, or community health workers have really done a ton to address the systemic issues towards care that a lot of our patients there unfortunately face.
During my research years, I was able to apply to a grant with the main goal of opening a Latinx clinic for colorectal surgery patients. As part of my research, we were able to show that patients that identify as Latinx and that speak Spanish or Portuguese as their primary language were found to have worse outcomes after surgery. And one of the reasons that that happened was because of that gap in language communication. They were unable to understand the instructions of the things that needed to happen before surgery, or they were unable to follow the instructions of what needs to happen after surgery.
Within the primary care track, we also have a social justice pathway. And I've really learned a lot of the barriers that a lot of our patients face, but also efforts that both the city of Boston and also BI are focusing on trying to address these.
One of the priorities for the Diversity and Inclusion Council that I run was to try to increase recruitment of underrepresented residents throughout specialties at BI. The first year, we had over 350 applicants join our Zoom session, and we had a panel of over 15 residents just answering questions very honestly about like where to live, where to eat, what is it like to work at BI and be underrepresented in medicine.
I think that there is a glowing community of just minority physicians. They try to really uplift a lot of our voices, even when it comes from making decisions about who is going to be some of the upcoming co-residents or some future applicants. They really try to make sure that we have a say as far as things that we like or dislike or that need to be improved.
There's different clinics and different efforts in the different departments. We have a Hispanic clinic for cardiology, liver clinic for rheumatology. There's a lot of us working together, and thanks to the support of BI, to be able to provide care to different populations.
Knowing that they are trying to make those strides to kind of even the playing field and give back to those communities is something that is pretty welcoming and that I appreciate, especially as a patient who's also from one of those marginalized communities.